Hi, my name is Sarah Schufelt, and I work for the School of Public Health at University at Albany, and I'm here to provide some directions on how to provide your saliva sample. Before you begin, make sure you don't eat, drink, or gargle within 30 minutes of providing your sample. Make sure you are in your residence and your kit is on a clean surface. Please remove a specimen collection bag, a tube, and an alcohol wipe from your test kit. Before opening the tube, let the saliva accumulate in your mouth for a few seconds. We want the saliva that accumulates in the front of the mouth naturally, so do not hawk or produce by force from the back of the throat. It may take a little while for the saliva to produce. If you think of eating citrus or your favorite food, sometimes that will help the saliva to accumulate at a faster rate. It is normal for the saliva to foam. You only need to fill the tube to the 1 milliliter line or to the end of the pointy part of the tube. Then screw the cap back on. Then thoroughly wipe off the tube with the alcohol wipe that you were provided in your kit. Make sure you wipe it all over. Place your filled tube into the bag using the zip top. Seal it tightly, and fill out the date collection field on the bag. Make sure you enter today's date, or the date you provided the sample. Roll up the bag, and put it in a safe place for delivery to your nearest drop-off box. It is important that you follow these simple collection instructions in addition to all other guidance provided by the University at Albany towards our mission of keeping our academic community healthy and safe. Thank you for participating.